Hello everyone, my name is Justin Nachimuli Chigozi. My professional background is psychiatry and I have a master's in public health. I'm a CEO for MBS for mental health in Black, Asian and ethnic minority communities here in Liverpool, Merseyside. I have been tasked this morning by parents to tell them more about my mental health awareness projects that I do every October during half term here in Merseyside. Our mental health project is targeted towards supporting our children with intercultural development model. For those who understand the intercultural development model, this is growing up in an environment that hosts more than one culture. In an environment that we don't call monocultural, but we call intercultural. The aims for this project is to support our children with tolerance, adaptation, understanding, empathy, but also being able to develop sensitivity and emotional intelligence. Why do we do this? For many years, I have spoken to my peers about the systems that we live in the diaspora try to outwardly show that they've got an intercultural approach to our needs. However, their policies are very monocultural. And fortunately, this has been showed by the outcomes of the COVID crisis. We all know that during COVID, Black, Asian, and ethnic minorities died more than the others. And this is because most of the policies in the diaspora do not address our needs. So on Mental Health Awareness Day, what we do for those 3 days, we separate our children into an age-appropriate group. We look after children of primary school age and place them in one group, and children of secondary school age. I do not deliver the project myself, but I collaborate the project. So I get professionals from the National Health Services that work with those ages to deliver this program. Our children of secondary school age go through programs related to hate, bullying, gun crimes. So we get the police to talk about that, but supported by people who have grown up in the diaspora, born in the diaspora, or come here as young, so they can relate to that. So we help our children digest it in a way that they can relate to. For the secondary school age, again, we talk about mental health, but we all understand that the intercultural model shows that we filter mental health differently. Black, Asian, and ethnic minority, we have a different attitude towards mental health. We have a different knowledge set towards mental health. But it is also very clear that we live in denial, confusion, and we all think it will never happen to us. We never train our children to know what they'll do when a parent is dead, what they'll do when parents separate, how they'll cope with a crisis if they were taken into care, if they've seen a stabbing on the street. We never know how to deal with that. Even I don't have enough time to tell my own children about that. So professionals talk to them about conflict resolution, crisis management, moving from home to university. It all entails around emotional regulation. And these are things that we don't do very well at home as parents. I have met parents who minimize the project and say, well, I am this and I do well with my children and my children can, understand all that. But you will be surprised. So in brief, Bring your children to mental health awareness every October half term, Thursday to Saturday. It is free. We provide transport for you. We provide meals for you. It runs at All Saints Church every year, run by mental health professionals, social workers, and the police. We provide transport for all our children who come, and the children do enjoy it. One child actually said something very interesting, and it remained in my heart. She said, I enjoyed being around people of my color. So here in the Northwest, I'll tell you that when my daughter started primary school, she was the only black person in her class, and there was one other in year 5. So there were 2. So in a way, they feel very swallowed up. So you will see that our children enjoy it. Secondly, they enjoy the socialization model because they socialize with others and get to know others. So do not miss out. Do not minimize it. Do not criticize it. If you have any issues with it, please ring us and we can clarify those things for you. Our website is www.mindbodyandsoul.org.uk, or if you just type in Musa or Justin Nachmalichikas or Justin Nachmalichikas, you'll be able to find our contacts for MBS. Thank you very much, and see you at All Saints Church on the 28th of October to the 30th of October 2021. Do not miss our theme of Alone and Frightened, Life After COVID. Thank you very much, and hope to see you there.